Hello, can we start? Okay, hello everybody. This is Dr. Heena Momin Kamdar. I am a gynecologist, obstetrician, and laparoscopic surgeon practicing here at Santa Cruz. I have my own practice at Dr. Kamdar's nursing home, and I'm a consultant at Surya Nursing Home. Uh, it's a pleasure to be here once again with BabyChakra, and I would love to share a few thoughts on certain topics which are very dear to my heart as an obstetrician. And I would love to answer your queries and help you whatever I can. So let me begin. The topic that I'm going to be speaking about, and I'm going to help you out today, is the healthy weight gain in pregnancy. So, as you know, that pregnancy is indeed a very special time where a female undergoes a lot of changes in her body, and she has to take care of not only her own but also the little being that is growing within her body. So then providing nutrition for this baby is very, very essential, and it has to be in a healthy pattern. It has to be in a pattern where the baby and mother both benefit and they have a smooth and comfortable pregnancy. Now, pregnancy, since the duration is about 9 months, we have to monitor the growth of the mother and the baby, and also look at the overall condition. There are a lot of changes in a woman's body that take place, right from metabolic level to structural to every organ in the body undergoes some changes when a woman is pregnant. So we are always concerned, and now with changing times, females are very conscious about health, about weight gain, and we want the best for our child. But at the same time, we do not want to, put on too much weight, or we do not want to, at any point of time, have a baby which is not well nourished. So these are a lot of changes that we have to keep thinking about. We should That's why we always recommend that when a woman gets pregnant, see your obstetrician, because it is very essential to start well from the beginning. When we talk about weight gain in pregnancy, we let us just look at different trimesters. We have three different trimesters. We have the first trimester, which is predominantly when the woman gets to know that she is pregnant. She is the kind of has most commonly, majority of the women have morning sickness. They have symptoms where they have nausea or vomiting at times. Even if there is no vomiting, there is loss of appetite. तो ये सारी चीजें होती हैं फीमेल के बॉडी में, और ऐसे में वेट गेन कितना होना चाहिए, मैं ठीक से पुट ऑन कर रही हूँ, मेरे बेबी को न्यूट्रिशन मिल रहा है, मुझे कमजोरी हो रही है. These are all lot of common queries and doubts that women come to. So that is the first trimester, and then second trimester and third trimester onwards, things get a little better. They are able to tolerate food, but then mind you, every pregnancy is different. Some women even keep having nausea and sickness till the last day, till they deliver. So we have, every female has to be evaluated on her own merit. So one should, as soon as you get to know that you are pregnant, you should kind of go to your obstetrician, because it is starting with your pre-pregnancy weight, your early pregnancy weight. What we as obstetricians should kind of also assess is that it cannot be a generalized. There is no one size fit all formula for weight gain. You have to individualize. If a woman is kind of slightly underweight, so based on the BMI, the body mass index, we kind of assess as to what should roughly be the weight gain that the woman should put on throughout pregnancy. So based on the body mass index, if she is a little underweight, if she is below 18 in the body mass index, which is basically your weight in kilograms divided by the height in meters square. So that will give you the body mass index. So there are different categories. If the one is underweight, it's okay to put on even up to 18 and 20 kgs of weight if a woman is underweight. If a person is approximately within the normal range of BMI, then it is okay to put on even up to 16 kgs of weight. So there are variations. With someone who is already overweight, someone who is on the obese side, we cannot tell them that you have to put on 10 or 12 kgs. In fact, weight gain will happen, but it has to be in a healthy pattern. It cannot be too much of weight gain, because that can also cause a lot of problems. There are a lot of issues which develop, like hypertension in pregnancy, like diabetes in pregnancy. There is even, it can even lead to clotting, so deep vein thrombosis can happen in the mother. So these are things that we have to keep monitoring. You have to start with visiting your gynecologist, your obstetrician, from the time you get pregnant. और फिर उसके बाद वो बताएंगे आपको कि रेगुलर इंटरवल्स पे आपने आना है, रेगुलर वेट मॉनिटरिंग होती है, और उसके बाद कैसे क्या खाना है, कौन से न्यूट्रिशियस चीजें हैं जो आप लोगे तो आपको उसका बेनिफिट मिलेगा. So I think we are ready to take some questions. Why don't we just go directly to questions? Let's answer your questions, and that will kind of help you understand this better. So let's start. So the first question is by Heena, who says that, hello Heena, can you please repeat that question? I missed out on that question. It's not coming on my screen. Okay, so she is 7 weeks pregnant, and how much should the weight is important during pregnancy? Okay, so Heena, as जैसे मैंने आपको बताया कि weight gain in pregnancy होना चाहिए. अब it should not be too much weight gain, it should not be less. So let me just make it a little. If you are depending, so if you are an average weight, if your body mass index is within the normal range, it is, you're not obese or underweight. Let's begin with that. Within the first पहले 3 महीने में, I do not, it's okay even if you do not put on any weight. If you put on a kilo or so, it's okay. In the first 3 months, if some women, there is so much nausea and vomiting that they even lose weight. But do not panic. First 3 months, just focus on what you can eat. There are certain things, certain foods जो आपको बोलेंगे आपके obstetrician जो आप नहीं ले सकते, वो आपने नहीं खाना है. For example, we avoid papaya and things like that. And then the second and third trimester, we talk about, for an average weight woman with a normal BMI, there should be at least 1 kg weight gain in 15 days. So in a month, you put on about 2 kgs. So therefore, if you calculate, अगर हर महीने आप 2 किलो put on कर रही हैं, और next 6 months में, it's about 10 to 12 kgs, which is good. But then again, what you're eating has to be monitored by you and by obstetrician. Can we have the next question, please? So Rachna, hi. She says, Doctor, I am 30 weeks pregnant. My weight is 70 kg. Will that affect my pregnancy? Okay, so Rachna, you are 70 kgs, but I don't know what's your height. If you are 5 feet and you're 70 kgs, you are overweight. If you are 70 kgs and you are like about 1.6 meters, you are about 5'6", 5'7", then 70 kgs is manageable. But that's okay. You have to see to it that whatever your weight gain happens over the next 6 months of your second and third trimester should be more of a high protein diet. Avoid certain high sugar content. Avoid maida as far as possible. Avoid oily and fried food that will also increase your acidity and unnecessarily cause unnecessary weight gain. So what are the best foods for weight gain in pregnancy is what Rita says. I have not gained weight. I'm 4 months pregnant. Sorry, I couldn't read the question further. Yes, very good. Now, if you have to put on, if your doctor says that you come to me after 15 days and yes, अगर हर 15 दिन बाद आप चेक करोगे और वेट 1 kg वेट गेन होना चाहिए, अब आप वो रोज बर्गर खा के भी आपका वजन बढ़ जाएगा या रोज पिज्जा खा के भी बढ़ जाएगा. बट डू यू अंडरस्टैंड दैट हैज अवॉइड जंक फूड, बिकॉज healthy high protein diet which is for in the form of in a vegetarian diet is dals, moong, pulses, paneer. This will increase your high protein content. And if you have a non-vegetarian diet, even 1 egg a day along with some dal and proteins and sprouts at least once a day will do the job for you. It will give you healthy proteins, it will give you healthy weight gain. वही चीज आप बर्गर खा के खाओगे तो your baby is not benefiting. It's only you are putting on more fat. So I'm sure that's not what you want. Correct? So you have to have a balanced diet. You have to have a good protein intake. You have to have fruits. You have to have vegetables. You have to have your share of curd or yogurt or milk for your calcium content, iron rich foods for your iron content. So a balanced diet, simple home cooked food is what you need to have. Indulgence once in a way is okay, but you be careful because this is what is going to form the foundation of your baby's health. If you're vomiting a lot, okay, sorry. Aarti says, hello, nice to meet you. I am pregnant. Can I see Aarti's message once again, please? Okay, that's a very good question. Congratulations, you are carrying twins. Twins are twin pregnancy is a very special, but it is also a challenging duration for the mother and the babies and the obstetrician. So healthy weight gain, very, very important. Now, you don't have to eat double, but you definitely have to have a little more weight gain, because your baby will also carry that much weight. So a higher protein diet. And again, I am stressing that eat healthy food, fruits, vegetables. Every day you should have certain food groups decided, that my protein intake, my calcium, my iron, besides the tablets, iron rich foods, calcium rich foods, high protein intake should be there. And do not forget one more thing, please exercise during pregnancy. Do the stretches, do basic stretching exercises. Best is go for walks. Start with a 5 minute, 10-minute walk. Go on increasing every 5 minutes and go for walks. It will keep you active. It will keep you healthy. It will take care of the unnecessary fat that you might possibly put on. Okay. And do not panic that your weight, doctor, I was 60 kgs, I have become 75. In the entire pregnancy, आप ये समझो कि आपके बेबी का वेट अप्रोक्सीमेटली 2.5, 3.5 kgs है, प्लस आपके बॉडी में जो प्लेसेंटा है उसका वेट होता है, बच्चे के आसपास पानी होता है उसका वेट होता है, आपके ब्रेस्ट एंगोज्ड हो जाते हैं उसका वेट होता है, बॉडी में फ्लूइड रिटेंशन होता है, ब्लड वॉल्यूम इंक्रीज होता है. तो प्रेगनेंसी में ये जो आप 10, 12, 15 kgs पुट ऑन करते हो, वो डिलीवरी के बाद मेजोरिटी आपका शेड हो जाएगा, बिकॉज इट वाज द बेबी इज आउट, द लाइकर इज आउट, प्लेसेंटा इज आउट, ब्लड वॉल्यूम रेगुलराइज हो जाता है, फ्लूइड वॉल्यूम रेगुलराइज हो जाता है. एंड अगर आपने हेल्दी खाया है तो आपके बॉडी का फैट कंटेंट ज्यादा कुछ नहीं बढ़ा होगा. ये आपके प्रेगनेंसी में एंड देन व्हेन यू ब्रेस्ट फीड योर बेबी, you within the first 3 to 6 months you will be able to shed a lot of the extra weight that you have put on. So you don't have to panic. It's not difficult. Only eat correct and exercise daily. आपकी capacity के हिसाब से करना जरूर. So Mahesh says, question for my life, is it safe to diet during pregnancy? What do you mean by diet? You cannot go for any fancy fad diets anyway. And in pregnancy, definitely not. Eat healthy, fresh foods. If your wife is a little overweight, if her BMI is on the higher side, cut down on refined sugar, cut down on high carb intake, cut down on junk food, and replace it with healthier food. There is nothing that you cannot make tasty at home with a little effort, and it's possible. So you have to understand that do not starve. Replace your unhealthy food with healthy food. Hello, congratulations. We have someone who's got pregnant with infertility treatment. I'm sure you've been through a challenging time, and I wish you congratulations and best of luck for the pregnancy that lies ahead. I think ये सब जो हमने अभी डिस्कस किया है वेट गेन के बारे में, ये आपको यूजफुल होगा. So she says these days feel too tight and weight gain, is it normal? You have to monitor the weight gain. Every 15 days you put on 1 kilo weight put on करना है, तो within a month 2 kgs put on होगा. और अगर आप हेल्दी खा के कर रहे हो, उतना वेट गेन आपका हो रहा है और आप रेगुलरली वॉक एक्सरसाइज कर रहे हो, तो आपको हेल्दी वेट गेन ही होगा. सेकेंडली, अगर आपको टाइटनेस फील हो रही है, यू नीड टू सी an obstetrician who will assess that is it anything to do with the uterus, because sometimes preterm labor pains भी होते हैं, or is it just gas and it is just indigestion. So ये सारी चीजें तो एग्जामिनेशन पे फर्दर आप आगे आपको पता चले. When in doubt, please see your obstetrician. Okay, I think we are done with the questions for today. The takeaway message is that eat healthy. Putting on weight is normal in pregnancy, but eating healthy and healthy weight is very, very essential. So regular monitoring every stage of pregnancy, be it in the first, second or third trimester, आप regular intervals पे आप चेकअप कराते रहो, आप अपने आप को मॉनिटर करो. इंडल्जेंस once in a way is fine. आप अपने आप को गिल्ट फ्री कभी कभी ले खा सकते हो, because pregnancy is the time to get pampered, but at the same time be mindful about what you put in your mouth. Be mindful of your overall health, because that is the foundation for your baby and for your future health. All the best, and it was a pleasure once again. I hope you have benefited. If there are any more doubts, if any questions, you can Google my name. You can reach out to me at my hospital. You can come and see me. I will love to be of whatever help I can. Okay, so my name is Dr. Heena Momin Kamdar. You can get in touch with me at Dr. Kamdar's nursing home. You can message, you can email to us, and I would love to answer your queries. Come and meet, see us. It'll be fun to interact, and I would love to give you more details. This is too short a time, so I can tell you what foods are rich in each of the food groups, and it'll be, I would love to help you with a healthy pregnancy.